to go forward to the American people in a bipartisan way and say, you know what, we're going to do it now. We're not going to worry about the results of the next election. That will take care of itself. The American people understand who they want in Congress and who they want on 1600 Pennsylvania Avenue based on what we do to save these legacy programs. I thank my colleague for yielding me the time, Mr. Speaker, and I'll yield back.
I thank the gentleman from Georgia, my colleague and physician. Let me say parenthetically here that what are some of the things that we in this chamber, we Republicans from the Doc Caucus, which by the way is 23 strong, which includes 3 nurses and 2 dentists and 1 psychologist. And so what are some of the things that we agree on moving forward that we really need in terms of saving Medicare? Well, I can tell you one thing that everybody agrees on, and that is that we need robust competition among providers, doctors, hospitals, insurance companies. There's no reason why they shouldn't have to deal with the competition of market forces. And why? Because everything in America that we see improves because of the marketplace. That is, that when you compete, it makes you work harder, it makes you try harder, it raises the level of effort, and ultimately you end up with better quality service and products, and you end up with lower cost to the consumer. We also agree that we want choices for Americans. Today there are a lot of choices even for Medicare recipients that just aren't there, and we want that to occur. We also want to move away from a top-down bureaucratic system where, again, a 15-member appointed board of bureaucrats, nameless, faceless, unelectable, unaccountable people who are selected and who will not be there to answer your call. We all agree that that is not a good thing. Instead, we want a program, a system in which you can change health care systems, you can change hospitals, doctors, insurance companies, whatever you want to do, and there's lots of transparency in order to do that. That's going to make the quality of care improve and the costs go down. Well, now I would like to recognize another gentleman from Georgia. Georgia, like Louisiana, is flush with physician members in Congress, but we'd like to have a few more, in fact. So I would like to recognize my good friend, Dr. Brown, the gentleman from Georgia.
Dr. Fleming, I appreciate you yielding me some time. Mr. Speaker, the American people need to understand very clearly that this administration, this president's policy on Medicare, as well as our Democratic colleagues here in the House and the Senate, can be summarized by 4 Ds. They want to deny that there's a problem. They want to delay fixing it. They want to destroy Medicare as we know it today. And they want to demonize those of us who want to fix it so that it is a good and solid program for the future generations of this country. That's exactly what we're trying to do here tonight, is focus upon the fact that, number one, they do want to deny it. They even deny that there's a problem. They keep saying that they want to save Medicare as we know it today. But Medicare is not sustainable as we know it today because it's going broke. And it's going broke because of failed policy of this administration, and it's getting worse and worse. Hopefully we'll see the Supreme Court throw out the Affordable Care Act, the President's health care reform bill, which is going to be disastrous. It's going to destroy the doctor-patient relationship. It's going to destroy budgets from individuals' budgets, businesses' budgets, states' budgets, even the federal budget. IPAB, as Dr. Harris was talking about, is going to be disastrous because we're going to have rationing of care. Our Democrat colleagues and this president wants to deny that there's any problem there. They want to delay doing anything about it. And in fact, in the Ryan budget, our budget that we passed last year started the dialogue, started the process of looking at trying to fix Medicare for future generations. But our Democrat colleagues don't want to do that. They want to delay fixing it. They just want to posture. They want to try to do anything that they can to face the fact that we've got to deal with Medicare and the financial problems that it has, that my good friend from Louisiana, Dr. Harris, talked about. And their policy is going to destroy Medicare. They're already destroying Medicare Advantage. We've seen, as Dr. Fleming talked about, We've already seen the President's Affordable Care Act has destroyed Medicare Advantage and has cut $500 billion, $500 billion out of Medicare. And then they want to demonize us who want to do something about it. I introduced my Patient Option Act, which is a comprehensive health care reform plan. And it deals with Medicare. It helps to save it for future generations. I introduced it in the last Congress. We reintroduced it to put in place a repeal section to repeal Obamacare and replace that disastrous law that we have in place, the Affordable Care Act, with something that makes sense that will lower the cost of all health care services and products for everybody in this country. We're tweaking it, and I'm going to reintroduce my Patient Option Act just in the next week or two. It's just a little over 100 pages. It's a comprehensive bill. It's market-based, and it puts the doctor and patient in the charge of making all health care decisions, not some bureaucrat here in Washington, D.C. that the President and our Democrat colleagues want to have in every single doctor-patient relationship, whether you're on Medicare or not. They want to insert a bureaucrat from Washington, D.C. to make those decisions for you. The American people need to know, Mr. Speaker, that our colleagues on the Democratic side and this President, if they could have their way, they're going to deny there's a problem, they're delaying fixing it, they're going to destroy Medicare as we know it, and they want to demonize us that want to fix it. And we're not going to sit still. We're not going to have it. We're going to continue to fight to make Medicare available, make insurance available for everybody at a lower price. And that's exactly what Republicans are doing. We have a plan, many plans. Actually, there have been numerous bills introduced by many colleagues on our side, physician colleagues. Dr. Tom Price from Roswell, Georgia, orthopedic surgeon, one of our Georgia colleagues, introduced his plan. We've got many plans here. So we're fighting to save Medicare. Our Democrat colleagues and this administration, this President, are going to destroy it. Now I yield back.
Well, I thank the gentleman, my good friend from Georgia, a family physician of note, and also one who's actually re-entered the U.S. Marine Corps as a reserve physician as well. I admire him for that. Before I recognize my friend from Tennessee, also another physician, I want to point out something about Medicare that it's very important for everyone to think about. You know, Medicare was started in 1965 with a lot of promises, and the promises have been fulfilled to those recipients who get the benefits of Medicare. However, this big, beautiful apple, if you will, of Medicare, unbeknownst to a lot of people, has been slowly rotting and decaying from the inside financially in ways that the public can't see, in a way that's very soon going to be evident. And why? The reason is because even though folks pay their premiums into Medicare, they do not nearly cover the cost of Medicare. In fact, they only cover about a third. The other two-thirds come from the providers themselves and also from the taxpayers. And that's all well and good. There's nobody we would rather do more for than those who are from the greatest generation, those who lived through the Great Depression, World War II. But the fact is we cannot continue the same way. It will totally bankrupt the country. And therefore, we have got to heal this patient, and that is we've got to save Medicare. I want to recognize my good friend from Tennessee, also an OBGYN, one who came here in 2009 as I did. We've grown to be great friends, and certainly the best doctors are from the South, mostly from Louisiana and Tennessee. I think you would agree.
I totally agree.
And so with that, I yield to my good friend.
I thank the gentleman for yielding. And Mr. Speaker, I want to thank all of my colleagues for being here tonight. And one of the things in the Health Caucus we're so blessed with are 3 new additions of registered nurses, psychologists, dentists. We really cover the whole spectrum of health care, and I think 21 or 22 members of the Health Caucus now, 15 physicians. And this is the first time, probably in years, that the House has had this kind of support from the health care community around the nation. This weekend I had an opportunity to talk to my wife a little bit about what my purpose was here in this House. I'm a veteran, as you are. I served as a practicing physician as I think every one of the doctors' caucus on the Republican side have been out for years, decades, myself 31 years of private medical practice. Medicare came along in 1965 when I was a college student. And the reason it came along at that point was because half of our citizens, when they retired, didn't have access to any health care coverage. So there was a problem noted, and at that point in time, that plan started as a $3 million program, really a skeleton program in the federal government. The government estimators, there was no Congressional Budget Office then, but they estimated that in 25 years this would be a $12 to $15 billion program. The actual number was $110 billion. Today it's over $500 billion, and a very important program because you and I, Dr. Fleming, have seen incredible advances. I could sit here the rest of the night and talk about the last 30-plus years of medical advances that have been applied to our patients, and medication, surgical procedures that have improved the quality of life of every American citizen. And one of the strange things happened when I was a very young doctor, 31 years old in Johnson City, Tennessee. I noticed that my 30-something years later, my 40-year-old patients were in their 70s, and they were on Medicare. And I had a chance to follow them throughout most of their adult lives and see the care that they got. And one of the things I think that our Health Caucus and our Physicians Caucus is absolutely committed to is saving Medicare. It's a great program, but it is not sustainable. And one of the frustrations I've had here on this House floor is how can you solve a problem you can't even talk about? When you're demagogued and told you that you're going to dump grandma off a cliff and you're going to do this, that's not solving problems. That's throwing bombs. I think this group of men and women are here to solve these problems. Otherwise, I don't really have a purpose here in this Congress. And so I'm going to commit myself, as I think our entire Health Caucus is to saving this vital program for our seniors. And it's been pointed out, pick your number. The estimators have been wrong before. Well, what if they're right? What if they're even close to being right? We've got to start solving the problem today and not wait. And the President's plan is to simply do nothing. Well, what are we talking about doing? What are we planning on doing? And before I get to that, I want to mention IPAB a little bit. This is hard to explain in a minute or two on a TV interview we might do, but the Independent Payment Advisory Board takes health care decisions away from where the health care decisions ought to be made. And those health care decisions ought to be made between the physician, the patient, and that patient's family, not between the insurance company and not between certainly a bunch of bureaucrats here in Washington, D.C. And quite frankly, I don't want a Republican president not putting them on there, and I don't want a Democrat president putting them on there. I want those decisions made in the examining room in the doctor's office between the family and the patient and the doctor. Now, the IPAB is, as Dr. Harris a moment ago mentioned, are 15 bureaucrats appointed, and we have 224 co-sponsors to repeal this bill, from Barney Frank to Phil Rowe. There's a lot of room in that tent to fill in, so all the congressmen could be on this because it is a bad idea. And my colleagues over here on the other side of the aisle, quite frankly, did not have this in the House version of the bill, as you'll recall. That came in the Senate version of the bill. So we need their support in a bipartisan way to repeal this. And why do we want to repeal it? We want to repeal it because it is based not on quality of care and not on access of care. It is based strictly on costs. And to squeeze more money out for the Affordable Care Act, that's why our seniors need to get involved in helping us get the Affordable Care Act or the so-called Obamacare plan overturned, because they are interlocked. And the money will come out of Medicare. So we have a bureau up here, a board, that says you spent this much money, and if you spend more, then it's going to come out of the providers, that's hospitals, doctors, and other health care providers, meaning that you will decrease access because they won't be able to see their doctor. And when you decrease access, you decrease quality of care. And no one in this country wants this. Has it been done anywhere else in the world? Absolutely. It's done in England right now. And we can go on with the horror stories of rationing of care, because that is ultimately what happens. And who gets rationed? Is it based on a certain age? Is it based on a certain disease? I don't think any physician in the world, I know morally I can't and ethically I can't do that. If a patient comes in, we have that conversation with the family, we put out a treatment plan, and we execute that plan. Now, how do we save it? I know we're going to talk about that in a little bit, but I want to point this out since I am on Medicare. Got on Medicare last year. The day before I turned 65 years of age, I had a health care plan. And in this health care plan was a hospitalization. It had a drug benefit. It also had the ability for me to go see my doctor. So it was a health care plan. Medicare has Part A, Part B, Part C, Part D. The only reason it's chopped up in parts like that is because politicians put it together. Not an access, not a way to see your doctor. What I think should happen to you when you're 65 is you should have a health care plan. It has prescription drug benefits, hospitalization, doctor benefits, and testing benefits like any other. And so what will we do and how do we plan on doing this? It's not hard at all. The premium support that we're talking about is just act like the federal government the day before when your business, your employer paid that part of the premium, the federal government will pay that premium. And the other part will be paid by you as an individual. And higher income seniors like us right here are going to get a bigger piece of that. And lower income seniors are going to have a small piece to pay. Or, if you want to stay on traditional Medicare, you're allowed to stay on traditional Medicare. In doing this, we can save this very vital program for our seniors. And I'm willing to sit down, as anybody in this caucus is, to talk to our seniors about how we're going to help save this. And I want to thank you, Dr. Fleming, tonight for holding this special order, and my colleagues for coming down here. And I'll now yield back my time.
Great. Well, I thank the gentleman, Dr. Rowe. Very insightful comments. And we're beginning to pull the cover back on what some of the solutions are. I will point out this evening that, you know, it's interesting the way physicians are trained. We're trained to be problem solvers. We're trained to look for solutions. And sometimes it's like mixing oil and water up here in Washington, because there are a lot of people who've been up here a long time who don't think in terms of solutions. So we're committed, all of us, our physician colleagues, and nurses, psychologists, dentists, to continue to apply the pressure to move forward in solving problems for the American people. I'd now like to yield to another physician from Louisiana. He's actually a hepatologist, and I know that some who may be hearing me speak right now may not know what that is. It's basically a specialist, a physician specialist in liver disease, and also a gastroenterologist as well. And with that, I will recognize the gentleman from Louisiana, Bill Cassidy.
Thank you, Dr. Fleming. I always tell people, hepatologists, no, I don't do snakes, I do liver disease, so you have to make that correction. I just want to kind of pick up where Dr. Rowe left off. A lot of folks say, heck, how do we end up with Medicare going bankrupt when they've paid into it their whole life? Well, if we work backwards, it began, if you will, or maybe the most recent insult, was the fact that the President's health care plan, the Affordable Care Act, took $500 billion from Medicare. Instead of putting it back into Medicare to support the program, it used it to create their new entitlement. Now, that's important, because as the graph you had earlier showed, at our current rate of going forward, by 2030, I think it is, Dr. Fleming, you have it right there.
Yes.
Roughly 2040, 2045, Social Security, Medicaid, and Medicare will take up the entirety of our federal budget. Whatever tax dollars we receive, by 2045 will be entirely consumed by those three entitlement programs. Do you have that graph where there is the debt on there as well?
This is the only graph I have.
So by 2030, I think it is, if nothing changes, Social Security, Medicaid, Medicare, and the national debt will consume 100% of our tax revenue. Clearly, we have to preserve this important program. The other thing I like to point out to people, in 1964, when Medicare was conceived, people were having on average 4 kids per family. And so the folks that came up with Medicare said, well, people are having 4 kids per family now. Most likely they'll continue to have 4 kids per family going forward. Let's make this a pay-as-you-go. There will always be 4 people paying for the 2 people ahead of them. Well, it turns out families have shrunk. Now, I'd point out in most crowds, most people have more brothers and sisters than they do children. Families have decreased in size. Instead of on average 4 kids per family, now there's about 2.5. That demographic shift has made all the difference. Instead of a pay-as-you-go program where there is always as much money coming in as we needed to pay out, what has happened is families have shrunk. You have a large number of baby boomers and then their parents, and beneath it you have a kind of a tree, if you will, where it goes straight down. Instead of the pyramid originally thought that would occur, we now have something that looks like that and then goes straight down. There is no longer this broader base of people paying in. So but this is not, we're not the first to recognize this. John Breaux, the former Democratic senator from Louisiana, was appointed by President Bill Clinton to say, listen, the demographics are changing. How do we preserve Medicare? And it was actually John Breaux, a Democrat, who first came up with the premium support model. Now, we speak of it sometimes as a Republican plan. No, it was originally a Democratic plan, and it was a bipartisan commission. It came up with this premium support model as the thing that would save Medicare. As it turns out, President Clinton became distracted with the Monica Lewinsky affair, if you will, and it kind of got pushed to the wayside. So the same Breaux-Carey model conceived of in the 90s is the basis for what is now the bipartisan Wyden-Ryan plan. Now, although Dr. Rose spoke of it earlier, it's worth going back over. If you're 55 and above, nothing changes from the Medicare program you've always known. Nothing changes. If you're 55 and above, if you're already on Medicare because you're disabled, nothing changes. If you're 54 and below, like I am, the program changes to premium support. Now, in the premium support model, it works kind of like Medicare Part D. I find the program that best fits my need. I choose the program that I want. If I'm very wealthy, I pay a little bit more. If I am poor, I pay nothing at all. But if I'm middle class, I pick the program I like. If it's a frugal program, then I pay less out of pocket. If it's a bells and whistles program, I may pay a little bit more out of pocket, much like the Medicare Part D program that seniors now get their drug benefit from. And by the way, a Medicare Part D program that has 80% approval among seniors.
If the gentleman will yield, by Medicare Part D, you're referring to the drug program, which is the last piece that was added, where there was a lot of debate about top-down government commanded pricing or a market-based system. They ended with a market-based system, and that reduced the cost by 40%. And I yield back.
And if I may reclaim my time, we both know because of market forces, not only is Medicare Part D incredibly popular among seniors, but its costs are 40% cheaper than originally conceived. That is the power of giving the patient the ability to go from plan to plan. If she doesn't like that plan, next year she chooses another. And the bad plan goes out of business if enough seniors do that. That's the same concept behind Medicare Part D. We have other colleagues to speak. I'll add one more thing. I'm always struck when our Democratic friends say they want the American people to have the same type of plan that members of Congress do. The premium support model is the same type of plan you and I have. We pick among an array of programs. We pick the one that works best for us, that matches our pocketbook. If we're poor, we pay nothing at all. If we're rich, we pay a little bit more, but most of us in Congress are in this middle range. We get the plan that most fits our needs. That is the Wyden-Ryan plan, totally. We actually give the American people the same sort of deal that members of Congress do. So, that said, thank you for allowing me to join you, Dr. Fleming, and I yield back.
Well, I thank the gentleman, again, even more insightful points. And just to reiterate, We in Congress, despite what a lot of people think, we don't have any kind of special health care plan. We have the same plan as all other federal workers, and that is simply to go on a website or in a booklet and choose of hundreds of excellent health plans that are competing with each other for our business. We pay part of the premium. Our employers, the federal government, pay the other part. And that's precisely what we want for everyone in America to have. But in order to do that, you've got to take down the walls from one state to another, state borders, when it comes to insurance. You've got to make sure that all of these providers of services, doctors, hospitals, insurance companies, are competing with each other, driving up the quality and driving down the cost. And with that, I would like to recognize one of our freshman members who's really come on fast, again, another physician, a family physician, Mr. Desjardins from the state of Tennessee, and I yield to you, sir.
I thank my colleague. And really, I'll be brief tonight, but I just wanted to point out a fact that I'm proud to stand here with my physician, nursing, dental colleagues, all the members of the Doctors Caucus, because I can say, I think for all of us, that none of us chose Congress as our career path in life. Our first passion in life was to help people, and we know that we have a problem facing us. Nobody can deny on either side of the aisle that Medicare is going broke. As Dr. Rose says, we can't afford to wait to solve this problem. It's there. It's not a partisan issue. It's a people issue. It's about my parents and your parents and our grandparents. And we just can't afford to let partisan bickering get in the way of solving this problem. So what I guess I would ask people to do, if you're a member of AARP, if you've not contacted your congressman or your representative or your senator, pick up the phone and make sure you know where they stand, because they can't answer you that Medicare is not going broke in the next 10 years. We've offered up a lot of solutions to try to stave this off, but we want to make sure that we help you save Medicare, and we're going to do all we can from our end, but we can only do so much. So if you're a member of AARP, call AARP, tell them to get on board. The GOP Doctors Caucus will help lead the way. I can say that all of us in this caucus, as we treated patients over the years, we never looked at them as Democrats or Republicans. We just looked at them as patients and people, and that's what we're here to do tonight. We're here to help save Medicare, but we need your help. So pick up the phone tomorrow, call your member of Congress, and make sure you know where they stand, and they need to get on board, and they can't deny that this problem's coming. And I yield back.
Yeah, I thank the gentleman. Did you hear that? Did you hear what the gentleman said? The gentleman said that he's never treated a patient that was either a Republican or a Democrat. It doesn't matter to us who are providing care. And we've got 3 wonderful nurses here, and we all appreciate what nurses do. Oftentimes the nurse is the first health care worker you encounter when you open your eyes after whatever's happened to you. And so we appreciate our angels so much. But again, we providers, we don't care. We don't ask whether you're a Democrat or Republican. All we care about is that you have a need. So I would like to recognize Congresswoman Ann Marie Buerkle from the great state of New York. We're actually moving above the Mason-Dixon line this evening, and we're talking to folks from New York. I yield to you.
And I thank my colleague, and I must say I feel a little bit out of my element. We've only dealt with Tennessee and Louisiana, so it's good to be here, and I appreciate the opportunity to stand here with my colleagues. I think it's so important that the Docs Caucus have this conversation with the American people, because we stand here tonight not as politicians, but as people who care deeply about the healthcare profession and about patients getting the kind of care they need. So I hope that when we speak to the American people, and particularly our seniors, because tonight we're talking about saving Medicare, that they look at us as people who are deeply committed to making sure that they have the health care and the Medicare benefits that they deserve because they've paid into it. So I guess, and briefly, because we have so many other colleagues here, I'd like to make just a couple of points to the American people. Number one, unfortunately, because of the current health care law, Medicare has been changed. So when we talk about saving Medicare, it really means restoring it to what the American people know Medicare as, especially our seniors. This health care law, and I am so saddened when I see some of the senior groups, AARP. In fact, I got a letter a whole box of letters from people who belong to AARP saying don't cut Medicare. and I want to assure the American people, I want to say to them, we are not cutting Medicare. For those who are 55 years and older, and as was mentioned earlier, if they're on disability and they're getting SSI, their plan doesn't change. It remains the same. But for those 54 and younger, we're talking about a premium support. And the reason we're talking about that is because if we don't, there will be no Medicare for anyone. So we're intent on saving Medicare. We want to make sure that our seniors have what they deserve, what they've paid into all of their lives, and that is good Medicare coverage. I'm not only a nurse, but I'm also the daughter of a 90-year-old mother. And she and I know very well how important Medicare is. So we have no desire to change Medicare as the seniors know it now. We're talking about making a change for those 54 years and younger. But the sad part about it is the health care law, the law has changed Medicare, and now our seniors will have to be dealing with IPAB, they'll have to be dealing with cuts in their Medicare services, and we implore, as my colleague said, for them to reach out to their senior groups and say, wait a minute, the real threat to our Medicare is the health care law, and that's what needs to be changed. And just before I end, I would just say to all the American people, we are committed here in the Congress and in this side of the aisle to making sure that you get the Medicare services you paid into all of your life, you so richly deserve, and you count on. We in the healthcare profession stand together, and we want to make that pledge to our seniors, but not only to them, but to all the American people. I thank my colleague, and I yield back my time.
I thank the gentlelady for yielding back. I'd now like to yield to another gentlelady, a person that I've become good friends with, also from New York State, and a person who has vision for America. Not only that, but she's someone who's been taking care of other people's vision as well, as she's an ophthalmologist. Yeah. But she's come to Washington to apply her vision to what she feels, and we agree with her, in what the future of health care should be like, as well as many other things in life. And with that, I yield to the gentlelady from New York.
Well, thank you, Mr. Chairman.
Nan Hayworth.
Thank you so much, and thank you for holding this special orders session, which is so important. And one thing, the comments by distinguished colleagues have been perceptive and enlightening and moving. One aspect I might be able to add, they have said so much, but I'd like to invite our seniors and those who love them and who may accompany them in the course of their care, as I have had the privilege of doing for my own parents, both of whom have relied on Medicare for many years. I'd like to urge our seniors and their families to talk with their doctors about what it means when Medicare changes the way it deals with the doctor's practices, and what it will mean for our seniors having the ability to be cared for by the doctors they prefer, and in the places where they're comfortable and that are familiar and that they like and trust. What may happen if Medicare loses the funds that now exist in the trust fund and that are running out very, very rapidly. And I think it's important for patients and doctors throughout the United States to have that conversation, and for our doctors to hear their patients' perspective, and for patients to hear from their doctors how tough it may be for a lot of doctors' practices to keep their doors open if Medicare loses the funds that it needs, and if that's accelerated through the Affordable Care Act, which does, as we've mentioned many times, but it's so important to say, that takes an enormous piece of crucial funding away from Medicare. We can't afford that. $500 billion is an enormous amount of money. So there are lots of threats looming on the horizon for our doctors' practices. I had the privilege of practicing ophthalmology in Mount Kisco, New York for 16 years, and I took care of Medicare patients, and I cherished them. And it was a privilege, as you've mentioned, Dr. Fleming, to care for those patients, so many of whom have done so much for our country and for our communities. But I can attest to the fact that it can be very difficult to keep your doors open when Medicare keeps ratcheting down what it will pay for certain services, even in the face of the fact that doctors have rent to pay and staff to pay, and they have insurance, including malpractice insurance, which can be very expensive in a state like my own home state of New York. So it can become very, very difficult to balance all those things, and that's why it's so important to make sure that Medicare has the funds it needs and that we protect Medicare for the future in the way that we handle its premium structure. Premium support will be a great help to us, but those are things that we need to hear from our patients and our doctors. So I'd like to urge everybody to talk with your doctors, find out the stories, find out what they want to tell you so that the patients and doctors can take that message home to their members of Congress, their senators, and to the President. And I want to yield back and thank you, Dr. Fleming, for all you're doing to support a wonderful cause.
Well, I thank the gentlelady from New York, Nan Hayworth, and for all of her contributions, both here in Washington and certainly back home. Certainly, we saved the best for last here. We have Dr. Benishek, the gentleman from Michigan, who actually managed time for our last special order, did a great job, and as I understand it, a wonderful surgeon. And so I would like to yield to you in the last few minutes that we have tonight.
Thank you, Dr. Fleming. I appreciate the opportunity to be here tonight to express my feeling about our cause to save Medicare. And I've been taking care of patients in northern Michigan in a rural setting for the last 30 years. And it certainly means a lot to my patients to have Medicare there to help them get through some their medical problems in their older years. And, you know, I'm kind of surprised that I've been castigated for voting to end Medicare, when really I voted to try to save Medicare because of the crisis that's coming forward because of the demographics of our country and the pending bankruptcy of the Medicare Trust Fund. Now, as I see it, there's like really 4 reasons why Medicare is in trouble. Number one, there's an increasing number of patients on Medicare every year. There's 10,000 patients a day are added to the Medicare. You know, there's like 50 million people today that receive Medicare. In 20 years, I think the number is 80 million people. Well, that's one reason. The second reason is there's like a little over 3 persons paying into Medicare for every person receiving that benefit today, but in 20 years there will be a little over 2 people paying. So not are there going to be 30% more people, there's going to be a third less people paying in. The third problem, of course, is just general rising costs in medicine. And that's an issue that I think our plan to save Medicare, a premium support plan where there's options in your insurance, will help keep those costs down. And of course, the fourth problem is the Affordable Care Act. You know, the Medicare that people are familiar with today, seniors that today have, that's not the same Medicare going forward, because the Affordable Care Act has taken $575 billion away from Medicare. That's over $100 billion from hospitals. I think it's like $40 billion from home health care, $30 billion from hospice care, and over $100 billion from Medicare Advantage. Well, I know in my rural district, we have many small community hospitals that depend on their Medicare payments, and $100 billion taken from each of those small hospitals, you know, those hospitals operate on a razor-thin profit margin. If we take that money away from my small hospitals in my district, they may not be there tomorrow. So how is my senior population going to come see me? They won't be able to come to their local hospital. They may have to go to Green Bay or Marquette or, you know, drive hundreds of miles to get evaluated in an emergency room, for example. This is not, you know, the way things are now is just not sustainable, especially with the Affordable Care Act impact on Medicare. And to think that if we do nothing, everything will be okay is just wrong. You know, we put forward this plan of premium support where you have a choice, just similar to Medicare Advantage, where in Michigan there's 20 or 30 different plans you can choose from, the one that suits you the best. I think that's a reasonable option. There may be others, though, that maybe another plan out there somewhere that's equally good. I haven't seen that, but I'm certainly willing to listen to a plan of how to fix it. But the mere fact of doing nothing is unacceptable. And I just think that it's just wrong to castigate those of us that are trying to find an answer that will fit most people and be affordable, and, you know, like many of the advantages that people have talked to previously this evening, you know, differences in different people's situations. To do nothing, though, to put your head in the sand like an ostrich and pretend there's no problem is not an option. So, like many before me speaking, I encourage people to speak to their physician about what the situation is. I'm going around my district this next coming several months and putting together a little Medicare meet and greet, you know, at the senior citizens centers, at you know, various locales of my district, to try to explain this to the patients, because they don't really seem to have an idea. I say patients, I guess I mean constituents, but speaking in the doctor terms, they don't have an idea how serious the problem is. And I think that's part of our problem, is getting that message out to other people that this is not something that we can ignore. This is not something that's just going to go away by not dealing with it. And this is certainly not going to go away by castigating people that are trying to find an answer. So I encourage those people, as Nan mentioned, to speak to their physician. Feel free to call my office to, you know, get further information. But realize that we're trying to fix a problem, not ignore a problem. Right. So with that, I'll yield back.
Okay. Well, I thank the gentleman for yielding back, physician from Michigan. Well, in the closing moments here, what have we learned? We've learned that we have a Medicare system that's highly bureaucratic, highly expensive, and as the graph showed, is going to be insolvent as early as 2016. That's 4 years away, and we desperately need a solution to that. We've got this side of the aisle, which has already come up with a solution, a premium support plan that basically offers to Americans the same opportunity we in Congress have, an excellent health care plan. And then we've got this side of the aisle, Democrats, who absolutely have come up with no solution. As the gentleman says, bury their heads in the sand, offer nothing. And I would submit to you, Mr. Speaker, that we can't continue going this way. We have got to move forward. We've got to find solutions by, again, putting health care providers in the arena, having them compete with each other, always from doing that. If it's a level playing field, and that's our responsibility in government, the quality of care goes up while the cost goes down. So with that, I want to thank my colleagues here tonight. We have had a great discussion, and I look forward to doing this again very soon. With that, I yield back.
Thank you. Thank you. Go ahead. Mr. Paul. So, excuse me? Go ahead. Mr. Paul? Under the Speaker's announced policy of January 5th, 2011, the Chair recognizes the gentleman from New Jersey, Mr. Plone, for 30 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I wasn't planning on coming to the floor this evening, but when I heard my Republican colleagues' special order that was just completed, I couldn't help but come down because I think I have to correct the record on many of the statements that they made this evening about Medicare and their efforts with regard to Medicare. First of all, I have to point out that when Medicare was first adopted in the House and in the Senate back in the 60s when President Johnson was here, the Republicans overwhelmingly opposed it. They were opposed to Medicare. They voted against it. It would never have passed if it was for their votes. It only passed as a Democratic initiative. And over the years, Democrats have been the ones to protect Medicare. Republicans have consistently opposed Medicare, tried to repeal it, tried to privatize it, voucherize it, and basically, as a once Republican speaker said, who I was here at the time when Newt Gingrich became the Speaker back in the early 90s or mid-90s, and he said that we want Medicare to wither on the vine. And that's basically what the Republican leadership has been doing consistently in the 20-something years that I've been in Congress. And certainly if you look at the budget that was adopted by the Republicans last year, it does exactly that. The Republican budget would end the Medicare guarantee, replacing it with a voucher in 2022. And what that essentially means is that right now, and under the Medicare program, when you get to be 65, you immediately become eligible for Medicare, which is a government program, and you're guaranteed that you have your health insurance through the government, through Medicare. But if you establish a voucher, which is what the Republicans tried to do in their budget last year, fortunately they didn't succeed, they would simply give you a voucher or a set amount of money for you to go out into the private sector and try to buy health insurance for that amount. And of course the amount that would be available wouldn't keep up with inflation, so even if you were able to buy health insurance when you were over 65 as a senior, which many people would not be able to, eventually you would not be able to, and you would simply have to pay more and more money out of pocket in order to buy the health insurance. In fact, we estimate that the Republican budget would double out-of-pocket costs by 2022 and cost an additional $6,000 for each senior, and out-of-pocket costs would triple by 2030. So what I want my constituents and everyone to understand is the reason that Democrats started Medicare in the 60s under President Johnson was because people over 65 were not able to get health insurance privately. They weren't able to go out and buy health insurance because basically insurers didn't want to cover seniors. They had too many disabilities, too many times that they had to go to the hospital or see the doctor. And so it wasn't possible to get health insurance if you were over 65. And I would maintain that if you let the Republicans move forward with their voucher proposal, which they still talk about constantly, the chairman of the Budget Committee, Mr. Ryan, keeps talking about it, the same thing would happen again. Seniors simply wouldn't be able to buy a health insurance with a voucher or without. The cost of it would get so prohibitive, and the consequences, Medicare would disappear, both as a guaranteed health insurance plan for seniors, and many seniors would simply not have health insurance at all. Now, the other thing that my colleagues tried to suggest tonight is that Medicare was going broke. Now, if you believe, which they tried to convince you, that Medicare is going broke, then that sets the stage for the fact that you should either get rid of Medicare or voucherize Medicare, because the notion is that somehow the government isn't going to continue with the program or can't afford the program, and therefore we need to change it drastically. I would maintain that's simply not true. Actually, right now there are 40 million seniors and 8 million people with disabilities below age 65 who have Medicare. Medicare is efficient. Per capita spending at nearly half the per capita increase for comparable benefits provided by private insurers. The fact of the matter is that the Medicare Trust Fund could certainly use some more money, but the way to deal with that is essentially to solve the economic crisis. In other words, as more people are employed, as unemployment goes down, and the economy grows, and more people pay into the Medicare Trust Fund, the Medicare Trust Fund would just be fine. Same thing goes for Social Security. The problem with the trust funds, whether it be Social Security or Medicare, is that in a slow economy, in a recession, less and less people who are working pay into the trust funds. So the answer isn't to get rid of the trust funds and not allow people to have a pension which Social Security provides, or allow people to have Medicare and health insurance when they're over 65, but rather to grow the economy, reduce the unemployment, more people pay into the trust funds, and they become financially solvent for a long time in the future. And that's what the Democrats have proposed. Our answer to the Medicare program is to try to put more money into the trust fund, grow the economy, and keep the Medicare as a federal guarantee, as a federal program that's guaranteed to all seniors. Now, I also heard my Republican colleagues tonight talk about how the Affordable Care Act, that's the health care reform, some people call it Obamacare, the health care reform, the Affordable Care Act, that somehow that was going to destroy Medicare. Nothing could be further from the truth. The reality is that the Affordable Care Act strengthens Medicare. The only cuts in the Affordable Care Act are to providers. There are no cuts to beneficiaries. In fact, programs for beneficiaries and benefits for senior citizens are actually expanded under the Affordable Care Act, and many seniors have already seen that. First of all, the hallmark of the Affordable Care Act, the health care reform, is prevention. And so what the Affordable Care Act says is that if you have some kind of health care, whether it's a mammogram or some kind of diagnostic test, you don't pay a copay. All prevention methods under the Affordable Care Act are provided without a copay. And, you know, that's mammogram, testing for prostate cancer, any kind of diagnostic test, or any kind of prevention program. And the reason for that is because we don't want people to go to the hospital. We don't want people to get sick. We want them to be diagnosed at an early stage. And so we know that if people have to pay a copay, a lot of times they won't have the test done. So that's number one. The other major benefit expansion under the Affordable Care Act, or the health care reform, is with regard to Part D and prescription drug benefits. Many seniors know that when the Republicans passed Medicare Part D, they left a huge, what we call hole, or donut hole, so that when you pay out of pocket up to a certain amount, in other words, when you incur Medicare expenses up to a certain amount in the course of the year, it was $2,000, now $2,500, whatever the figure is, then everything that you incur beyond that is not covered. And then you have to go to a catastrophic level, something above $5,000, to get your coverage again. So many senior citizens, when they start the year, are getting their prescription drugs, but by August, September, October, sometimes even earlier, they reach that threshold or donut hole, and their Medicare prescription drugs were not covered under the original Medicare Part D proposal. So what the Democrats did in the Affordable Care Act, what the President did in the Affordable Care Act, or Obamacare if you will, was to gradually fill in that donut hole over the life of the program. So the first year there was a $250 rebate, and then prescription drugs in the donut hole were discounted 50%, and gradually over the next few years that donut hole will disappear, so your prescription drugs will be completely covered, and you won't have the donut hole. Again, these are benefit expansions under the Affordable Care Act. So when the suggestion is made by the Republicans that somehow the Affordable Care Act is going to hurt or destroy Medicare, nothing could be further from the truth. Fact of the matter is that the Affordable Care Act strengthens Medicare, strengthens the benefit, expands benefits, whether it be for prescription drugs or diagnostic testing or prevention. Also provides a free wellness test every year where there's no copay, and actually pays money back in to the trust fund. So the life of the Medicare program, if you go along with what the Democrats are proposing, you know, whether it's their proposals to improve the economy, grow the economy, would actually shore up the Medicare program, contrary to what some of my colleagues said here tonight. You know, they mentioned different organizations. There was a group of doctors. They mentioned AARP. Most of the organizations, I didn't listen to the whole hour, but most of the organizations that they mentioned, American Medical Society, specialty doctor groups, AARP, these are the groups that supported the Affordable Care Act, that supported the health care reform, because they knew that it was strengthening Medicare and making Medicare more viable for the future and expanding benefits for seniors and the disabled that are covered by Medicare. This is part of the historic nature of the Democrats and Medicare. We started Medicare. We strengthened Medicare. We have done everything we can to make Medicare more secured as a guaranteed federal program. Republicans opposed Medicare from the beginning, continued to try to either repeal it or, in the words of Speaker Gingrich, make it wither on the vine. And now, in the latest proposal, the Republican budget here in the House of Representatives, the very Republicans that, my very Republican colleagues that spoke tonight, all voted for the Republican budget that would essentially get rid of Medicare, make it into a voucher, not provide the federal guarantee, and make it so that seniors were essentially thrown out with a voucher or a certain amount of money and had to go out and buy private health insurance, which they'll never find. So I had to come to the floor tonight, Mr. Speaker, and really tell the truth about the parties and where they stand on Medicare. And the fact of the matter is that the Democrats started the Medicare program and continue to make it viable. I yield back the balance of my time.
Under the Speaker's announced policy of January 5th, 2011, the Chair recognizes the gentleman from Florida, Mr. West, for 30 minutes.
Thank you, Mr. Speaker, and I ask for unanimous consent to revise and extend my remarks.
Without objection.
Mr. Speaker, in commemoration of Black History Month, I rise to acknowledge the Republican Party's proud and storied history of standing up for the rights of African Americans. The first black members of Congress served during Reconstruction, and they were all Republicans. They won their seats despite fierce threats of violence against black voters by groups like the Ku Klux Klan, and were successful only as a result of the firm support they received from the Republican Party. One of these members was Josiah T. Walls, a slave who earned his freedom through service to the Union in the Civil War. He settled in Alachua County in our sunny state of Florida and was repeatedly elected to Congress at large. In some ways, Mr. Speaker, I carry the torch of Josiah Walls. You see, in 1876, the Democrats contested his election and had him replaced midterm with one of their own. No black Republican would again be elected from Florida to this House until November the 2nd of 2010, when the voters of that state entrusted me to be their representative. On my desk in my office, there was a book called Capital Men, and it's a biography of those first black members of Congress. I stand where Josiah Walls and the other early black Republican members of Congress once stood. Hiram Revels of Mississippi, Benjamin Turner of Alabama, Jefferson Long of Georgia, Robert DeLarge, Robert Brown Ellicott, and Joseph Rainey, all of South Carolina. They were the ones who carried that first torch for my colleague Tim Scott. They would have stood here urging support for policies of equal opportunity for all. Mr. Speaker, I stand here this evening to recognize their legacy. The Republican Party has always been the party of freedom. Today, we understand that our principles are best served when we act as stalwart advocates of free markets. But historically, Republicans understood that the value of every human life is diminished when any human life is made to work against its will. Free markets are characterized by the free exchange of goods and services and by the free exchange of labor for compensation. See, Mr. Speaker, without free people, there can be no free markets. Where men are not free, freedom does not reign. And so the Republicans have always been the party of free men, of individual freedom. It was Abraham Lincoln, the president, the father of the grand old party, who signed the Emancipation Proclamation and brought about the freeing of the slaves. For many, this is the beginning and the end of the Republican Party's role in advancing equal rights. But that understanding misses the myriad ways our party went on to better the lives of black Americans and cheapens the many contributions that later generations of Republicans made to the cause of freedom. It was, in fact, Republicans of their day who worked to pass the 13th, the 14th, and the 15th Amendments, securing for African Americans deliverance from slavery, equal protection under the law, and the right to vote. Each of these accomplishments did its part to cement the fundamental freedoms all Americans enjoy today. None of them could have gotten off the ground without GOP support. Take the 13th Amendment, for example. At Abraham Lincoln's request, the Republican National Committee Chairman, Edwin Morgan, made abolishing slavery an official part of the party's platform in 1864. At that year's National Convention, he opened with a statement on the topic. He said, "The party of which you, gentlemen, are the delegated and honored representatives will fall far short of accomplishing its great mission unless among its other resolves it shall declare for such an amendment to the Constitution as will positively prohibit African slavery in the United States." The 14th Amendment was no different. A little-known fact about that law that granted black American citizenship with all the rights and privileges thereof is that every vote in favor was cast by a Republican, and every vote against was cast by a Democrat. And in 1968, when the Democrat-controlled legislature of New Jersey voted to rescind its ratification of the 14th Amendment, it was the state's Republican governor who vetoed that attempt. Mr. Speaker, it was the Republican-controlled 39th Congress that established the Buffalo Soldiers, a fighting force of 6 regiments of black American troops. They would soon become known for exhibiting the courage of a cornered buffalo in battle while posted to the frontier. In peacetime, they gained renown for being the finest horsemen the Army had to offer. And in 1907, the 10th Cavalry Regiment of the Buffalo Soldiers was sent to the United States Military Academy at West Point to teach the cadets riding skills and mounted drill. Mr. Speaker, think about that for a second. The commanders of that day, so confident in the ability of the Buffalo Soldiers that they entrusted them with the training of the next generation of Army leaders. And it was the Republicans who made that happen. It was the Republicans who passed the 15th Amendment as well. For once, the story is true that not every Republican supported it. A few abstained, saying the measure did not go far enough. It was the Democrats who voted against the 15th Amendment. And when it passed anyway, it was the Democrats who resorted to the use of poll taxes, literacy tests, intimidation, and other pernicious practices in an effort to keep black Americans from exercising their right to vote. And this was something that my grandparents and my parents experienced growing up in South Georgia. It was a Republican by the name of Senator Charles Sumner who got the Equal Rights Movement on its feet, a fierce abolitionist and leader of the radical Republicans. Sounds very familiar when they start talking about Tea Party Republicans. Senator Sumner wrote and shepherded the first ever civil rights bill through Congress. It was a Republican president and the great General Ulysses S. Grant who signed it into law the same day that it passed. And that comprehensive bill, the Civil Rights Act of 1875, would become the blueprint for every subsequent piece of civil rights legislation to come before Congress, despite the fact that it was struck down by a backward-looking court. It was the Republicans who first called for racial justice in the armed forces, not only allowing black Americans to serve their country, but welcoming them to serve their country alongside their white brothers. It was a Republican judge named Elbert Tuttle who time and again ruled in favor of civil rights and who went on to order the University of Mississippi to admit its first ever black college student. It was a Republican Supreme Court justice who authored the decision in Brown versus the Board of Education that recognized racial segregation for what it was, a violation of the United States Constitution. And when a school district in Arkansas refused to integrate, it was a Republican president in Dwight David Eisenhower who sent in the 101st Airborne Division to escort the Little Rock Nine to class. However, it was a Democrat governor in Orville Faubus, you may recall, who had tried to use his National Guardsmen to prevent them from enrolling. Mr. Speaker, Republicans were unfazed by the many Democrats, including John F. Kennedy and Lyndon Johnson, who criticized President Eisenhower's decision. Meanwhile, it was the Democrats in the Senate who filibustered the first Civil Rights Act of the 20th century, and the Republicans who managed to pass it nonetheless. The law established a Civil Rights Division within the Justice Department and authorized the Attorney General to request injunctions against anyone attempting to deny a person's right to vote. It was written at the behest of President Eisenhower after a long drought of civil rights bills under Presidents Franklin Delano Roosevelt and President Harry Truman. It was a Senate Minority Leader, Everett Dirksen, a Republican, who helped write the first Civil Rights Act of 1964, widely regarded as the most influential of them all. And in recent years, it's been the Republican Party that has fought to prevent African Americans from being trapped in a permanent underclass through dependence on government handouts. In the 1990s, it was the Republican-controlled 104th Congress that passed the Personal Responsibility and Work Opportunity Act. Then Democrat President Bill Clinton signed it only after reluctantly having vetoed it twice. This reform changed the face of welfare, ensuring that recipients who were able to work would be required to seek employment. No longer would government checks be seen as an entitlement. No longer would states have a financial incentive to add as many names to their welfare rolls as possible. Finally, there was an alternative to the cycle of poverty caused by years of misguided Democrat policy. And it's been Republicans who have continued to fight for the underprivileged communities, even as we're painted as the party of the white upper class. In 2004, another Republican-controlled Congress, under the leadership of Republican President George W. Bush, signed an omnibus bill that included a voucher program for school children right here in the District of Columbia. Instead of being shackled to the failed public school system, thousands of students were able to use the first federal government vouchers to escape to high-performing private schools. Mr. Speaker, what Republicans have long understood is that poor communities are best served when they're empowered to care for themselves. The more they come to rely on government checks, the less they learn to rely on their own ability and ingenuity. Our party firmly believes in the safety net. We reject the idea of the safety net becoming a hammock. For this reason, the Republican value of minimizing government dependence is particularly beneficial to the poorest among us. Conversely, the Democratic appetite for ever-increasing redistributionary handouts is in fact the most insidious form of slavery remaining in the world today, and it does not promote economic freedom. Time after time, the GOP has stood strong as leaders on issues of conscience. Even when the positions we've taken have been unpopular, we've held the line and ultimately brought about liberty and justice for all. From eliminating slavery to securing full citizenship and voting rights for African Americans, to calling for desegregation, even in the most hostile bastions of the Deep South, to implementing school choice in poor communities, to helping black families break out of the cycle of welfare dependence. Mr. Speaker, Republicans have been on the front lines of the fight for equal rights and individual manifest destiny since our party's founding under Lincoln. So, too, has the party led on issues like reducing the size of government, streamlining the federal bureaucracy, and returning power to the states. These positions didn't always garner the most popular support at the time. It's easier to convince a person that a government should be doing something for them it currently isn't, than to convince a person government shouldn't be doing something for them it currently is. But real visionary leaders don't retreat from fights. It is said that one evening as George Washington sat at his table after dinner, the fire behind him flared up, leading him to move his chair away so as not to end up getting burned. When someone called George Washington out, saying a general ought to be able to stand the fire, he responded that no general should ever be taking fire from behind. That is the essence of integrity and conviction, the willingness to stand for what you believe at all times, alone if need be, without the option of retreat, no matter how tough the slog ahead may be, and to do so with the faith that eventually it is possible to transform a losing fight into a winning one. For inspiration, we need only to look to the former slave and Republican Frederick Douglass. Having found his way to freedom through education and hard work, he could have been forgiven for retiring from the public eye. But he didn't back down from the work still to be done. Instead, he made himself one of the most stalwart champions of not just the anti-slavery movement, but the women's rights movement as well. He wasn't content to lend his political capital to causes that would benefit him. He knew what we know, that injustice anywhere is an affront to the human spirit. To free African Americans from the bonds of slavery was only the first step for Frederick Douglass, and we will not be satisfied until he helped liberate women from the bonds of misogyny as well. In those days, Douglass could count on the Republican Party to be his ally in the fight. Today, we remain no less dedicated to the cause of freedom. So therefore, Mr. Speaker, with a core belief in the supremacy and the sovereignty of the individual and the unconditional dignity of every human life, the Republican Party is, always has been, and forever shall be the party of equality of opportunity. Happy Black History Month. Thank you, and Mr. Speaker,